Hello, and thank you for joining our symposium today. My name is Leith Greenslade. I'm coordinator of the Every Breath Counts Coalition, and I'm delighted to be part of defining and acting on pneumonia research priorities from evidence to impact. Today, I want to talk about introducing the pneumococcal conjugate vaccine, otherwise known as PCV, in Somalia, Guinea, South Sudan, and Chad. Let's take a look first at the burden of childhood pneumonia, which should be very well known by now. So according to the Global Burden of Disease 2019 estimates, the latest we have, there were 672,000 children under 5 who died of pneumonia in the world, and no other infection causes anywhere near this burden of death. Half of all those deaths are in countries with less than 60% of PCV coverage. And you see the countries lined up here in the bar chart. You can see the dominance of Nigeria and India, but there are many other countries spread all across the world, all low and middle income countries, but spread in every region, where there are many, many children dying of pneumonia and where PCV coverage is low. To look at this another way, we've used the Vaccine Impact Modelling Consortium to estimate the number of children's lives that could be saved with high PCV coverage. And you can see the 20 countries on the map where the most children's lives could be saved with PCV coverage above 90%, which is what is recommended in Immunisation Agenda 2030. That's a lot of children's lives that this vaccine, it's a very, very powerful vaccine, could be saving if it was available to children in all of these countries. You can see the dominance on the map of China, the #1 spot. But then we move quickly to Africa, where we have Chad, Somalia, South Sudan, and Guinea, 4 African countries next in line, where many, many children's lives are at stake and where PCV coverage could really help these countries achieve their child survival goals. So let's take a look at Africa. All of those countries that are shaded yellow have the PCV. So Africa has done extremely well in introducing this vaccine, except for the countries in white. And most of those countries are Gavi eligible, including Somalia, Guinea, South Sudan, and Chad. They're amongst the remaining Gavi eligible countries yet to introduce PCV. And I want to underscore that across those 4 countries, they're losing 40,000, an estimated 40,000 children to pneumonia each year, according to the GBD, about 10,000 to meningitis and more to sepsis. And PCV is one of those wonderful vaccines that targets multiple pathogens. So it is preventive, not just of pneumonia, but also of meningitis and sepsis. So we began a process of engaging the ministries of health in each of the 4 countries because Gavi, as you will all know, has a policy of country ownership. Countries need to want the vaccine, want to introduce the vaccines before any support is forthcoming from international partners. So we asked the 4 ministries of health, those in charge of vaccination, what they felt about the PCV. And it was clear from all 4 that the countries well understood the burden of pneumonia and the power of the PCV. And this is a quote from the Somali Ministry of Health: based on the burden of pneumonia in Somalia and the evidence of PCV vaccination in reducing pneumonia in neighbouring countries, so they're looking at the evidence generated in other parts of Africa, there is great justification to speed up the introduction of PCV. So the countries understand what's at stake here. So what we did to help them further strengthen their data is we looked at 2 aspects of PCV coverage in each of the 4 countries: PCV impact and PCV cost. So just starting with the impact in Somalia, just to summarize, in the upper left is the burden. That's all GBD data. So you can see about 14,200 children dying each year, and that's just of pneumonia. We didn't add in the meningitis and sepsis deaths, so this is underestimating the burden. They've had an 11% reduction in those deaths since 2010. That's very, very slow rate of reduction relative to the reductions in other infectious diseases. And the leading risk factors for a child pneumonia death in Somalia are wasting, household air pollution, lack of hand washing, underweight, and stunting. You can see that the burden of malnutrition in that list of risks when it comes to childhood pneumonia deaths. But when we looked at how many deaths could be prevented with PCV coverage, it's a massive 32,600. And that data comes from the Vaccine Impact Modelling Consortium. and that is just with routine introduction of PCV. Many countries now are doing what's called catch-up campaigns, so every child under 5 receives a 1-dose catch-up. If Somalia did that, when they introduced PCV, there would be many more deaths prevented. We haven't estimated those, but we do draw your attention to a Kenya study that found that catch-up campaigns reduce the incidence of childhood pneumonia by an additional 40%. That's the incidence. So if Somalia went ahead and introduced PCV, how much of their child survival goals could be achieved? Well, we're using here what's called the GAP-D target as the goal, and this is the goal that every country has been asked to achieve, which is less than 3 child pneumonia deaths for every 1,000 children born by 2025. It's known as the GAP-D target. So that's the hard orange line you can see, which is the reductions in Somali child pneumonia deaths if they were on track to the GAP-D target, which they're not, because it's the blue line which represents the blue dotted line, the status quo, which is really no change at all in child pneumonia deaths because of birth rate and because of slow declines. And Somalia is a country dealing with multiple emergencies and crises at this point in time. But the PCV introduction brings us to the yellow dotted line, which is just shows the power of that's just one intervention. There's obviously many things you need to do to reduce child pneumonia deaths. The PCV is just one of them, but look at the power of it. It's able to close the Somali gap to the GAP-D target by a massive 40%. If you prefer to look at deaths prevented each year, it's another way of looking at the data. You can see even in the first year, you've got a 3,000 child lives saved from PCV, rising to 5,000 by 2030. So a steady increase in child deaths prevented with PCV coverage. Now the cost, and as far as we're aware, this is the first time the cost had been calculated, the cost of PCV introduction in such a way and publicly for Somalia. So we looked at the cost to both Somalia, to the Ministry of Health, and to Gavi, because the Gavi model requires co-financing. So the countries are asked to contribute some portion of the overall cost of this vaccine. And then we also looked at the different vaccine options, the brands available to Somalia. There are 3 that the WHO pre-qualifies: Pneumococcal, which is the new vaccine from the Serum Institute of India, Synflorix from GSK, and Pfizer's Prevnar. And so I'm not going to go through the table in great detail, but the basic readout is this is not a very expensive proposition for the Somali government. They basically need to find about $288,000 in the first year to introduce PCV. Over a decade, that mounts to about 3.3 million. But the initial cost is relatively low compared to many other health interventions, and certainly to the Gavi budget, which is extensive. So, nevertheless, the Somali government have told us that co-financing is a massive barrier to them introducing PCV, and they cite it as the major barrier at this point in time, that co-financing amount cannot be secured from the Somali budget. So the question remains where to secure the $287,000, a major problem that global health and development agencies need to now rally around. The cost to Gavi, which is section B of the slide, is about 25 million over the decade. There are various other grants that are available to Somalia and support to introduce. I won't go into that in detail. But there's also vaccine introduction grants that Somalia can receive as further incentive. So this is something that I think even the ministry officials, when we laid it out like this, the ministry officials felt it would be a much more expensive proposition than it in fact is when you take everything into account. So our takeaway from this was, due to the small amounts of money involved and the massive numbers of children whose deaths could be prevented, this represents a very cost-effective proposition for Somalia and indeed for Gavi, and there's no reason to delay introduction of this vaccine any further. Moving to Guinea now, Guinea too went on the public record with support for introduction of the PCV. In fact, they told us they were ready to do it in 2017. They were all set to go and delayed because of the Gavi rule that you couldn't introduce PCV until you had basic coverage of diphtheria, tetanus, and pertussis, DTP vaccine, 70% or above. Gavi relaxed that rule several years ago, but some of the ministries weren't aware of it, which is deeply unfortunate. And they held off their applications because there was this perception that they had to wait until they got their DTP to 70%. So Guinea was preparing to apply to Gavi in 2022, but there's been a change of government and things have been a little bit delayed in Guinea, but we expect them to be back on track sooner rather than later. Here again is the same picture for Guinea. So you're familiar with this slide now. In Guinea, they're losing about 7,300 children to pneumonia each year, 15% reduction since 2010, a little bit better than Somalia, but really these countries are struggling to reduce their pneumonia deaths. The similar list of risk factors. Now, if they introduce PCV, you get 11,300 child deaths prevented with routine vaccination, even more if they did catch up. And once again, they're able to close 40% of their GAP-D target gap. So once again, the orange line is the line you would want them to be on to achieve the GAP-D target. The blue dots are where they are, and the 11, the yellow dots, I beg your pardon, are where they would be with PCV introduction. So super powerful impact on lives saved from one intervention. If you like to look at lives saved this way, you can see how you're starting with about 1,000 children's lives saved in 23 and rising up to 2,000 by 2030. The cost, similar to Somalia, the Guinean government would have to come up with about $234,000 in 2023 to kick off PCV introduction, and over the 10-year period, about 2.6 million. So these are not large sums of money, even for public health. Gavi would need to find about $20 million over the decade. And once again, there are a mix of grants and other ways of support that the Guinean Ministry of Health could take advantage of. Moving to South Sudan, this is a very emotional plea we heard from the Ministry of Health in South Sudan, who appealed to all of the donors to respond to the issue of Gavi co-financing, which they said, once the same as Somalia, was a major barrier to introducing PCV. We are ready to act. I hope the donors will be with us and support us, and all of the fragile countries. Don't leave us alone, be with us. It's important to remind everyone that these 4 countries are fragile and conflict affected. And we know many of the children now dying are further concentrating in these countries. So these are a group of countries where current rules and requirements are really not working for them. And the Gavi co-financing barrier is one that we heard again and again from the ministries was a problem. South Sudan is losing about 5,400 children to pneumonia each year. They've had a better reduction, 34% since 2010. You've got the similar leading risk factors. Now, if PCV was running at full power, you've got about 11,900 child deaths prevented and more if they did catch up. But look at the impact on their GAP-D target. PCV alone would close 64% of the GAP-D target. And once again, the GAP-D target is this goal of less than 3 child pneumonia deaths per 1,000 children born by 2025. So if South Sudan is sitting down and thinking, what can we do to reduce our child pneumonia deaths? This is a no-brainer. The PCV it has to be the most powerful intervention of all they could choose to get closer to that goal, 64% of the gap closed. Let's take a look at the year-on-year child deaths prevented, beginning at 1,000 and rising to 2,000. So there's steady drumbeat of children's lives saved over the period with this vaccine. What would it cost? Less for South Sudan. They need to find about 173,000 to introduce this vaccine in a year, and about 2 million over the decade. So not a lot of money, once again. And then the Gavi costs are also outlined. And you get the 3 different vaccine types as well. And there are these vaccines do cost different amounts of money, quite substantially, not to the country. The country pays the same cost irrespective of the vaccine at this point in time, but Gavi pays a very different cost. So if you look at the cost to Gavi, the most affordable vaccine for Gavi and for donors who are paying Gavi is the Serum Institute of India's Pneumococcal. Our final country, Chad. Chad's losing 13,800 children to pneumonia. They've had basically no reduction since 2010 in their child pneumonia deaths. In fact, if you look at our projection there, you can see the blue line is rising. So Chad is in a dire situation with childhood pneumonia deaths. They have the same leading risk factors as the other countries. So we know what else we need to be working on aside from vaccines. But if Chad introduced the PCV, they would prevent the deaths of 35,000 children over the decade, more with catch-up, closing 44% of their GAP-D target gap. So for Chad, the Chad government, with all of its challenges, this particular vaccine can go a long way to reducing childhood pneumonia deaths and actually helping them also with Sustainable Development Goal 3.2, which is the overall child survival goal. Here are your annual lives saved, ramping up to almost 6,000 by 2030 with introduction of this one vaccine. The cost, there are a lot of children in Chad, so the cost to the Chad government is about 375,000 in the first year, about 32 million for Gavi over the decade. Once again, a variety of grants and other support lessens the impact on the Chad Ministry of Health and the government. So how to take stock of all of this data and information, which we have released publicly, not just to the ministries, but also to the international vaccine agencies like WHO, UNICEF, Gavi, and others whose job it is to support these countries to introduce these vaccines. So the work here is nested within what we call 10 actions that we have undertaken as a coalition to help these ministries introduce this vaccine that they want. So we have checked off 1 and 2. We've shown them how many child deaths can be prevented with PCV and the cost. We are keen now to help them identify the other benefits of PCV introduction. We know PCV introduction doesn't only reduce the problem of pneumococcal infection amongst children, but also adults, and particularly the elderly. There are benefits for antimicrobial resistance and also lessening catastrophic healthcare costs on families. The cost of hospitalizing a child with pneumonia is high in these countries, so vaccination prevents illness and prevents those costs on many families. We've also undertaken to provide ministries of health with assistance to support the Gavi application process. They have asked for that, and all of them want to introduce their application to Gavi in 2023. We want to work with them to make sure they can deliver on that. It's also important that this issue of Gavi co-financing and solutions to it is on the table. Maybe there have to be Gavi waivers with co-financing for these 4 fragile, complex countries, and maybe other countries that are in that category. If co-financing is all the barrier that's standing in the way of saving these children's lives, and we're just talking about finding a couple of $100,000 per year for each of these countries, 4 countries, this shouldn't be a barrier to saving so many children's lives. We want to help facilitate dialogue between ministries of health, global health agencies, and all PCV manufacturers. We find the communication channels aren't as robust as they should be, and we want to engage civil society in these 4 countries to help them advocate directly to their own governments for this particular vaccine. There is a humanitarian mechanism, which is a special way NGOs in fragile settings can get access to the Gavi price for PCV, the lower price to vaccinate children. It hasn't been used extensively for PCV introduction. We think there's more to be done with the humanitarian mechanisms, so we want to see if we can increase access to that. And of course, we want to provide very high-profile opportunities for governments to launch the PCV in 2023 when they're ready to do so. This is a major step forward they'll be taking in terms of SDG 3.2. So it's something that should be celebrated. And finally, we need to track and publish national progress to full coverage of the PCV. At the moment, we're reliant on the World Health Organization, UNICEF estimates, which are updated not as regularly as we would like. We want to be able to track progress, not necessarily in real time, but as much more quickly, so people can feel the impact of PCV. This is a vaccine that has impact incredibly quickly. Studies have shown that when PCV is rolled out, hospitalizations are reduced very quickly, and very soon after that, deaths come down. So it's one of the highest impact ways governments can reduce their childhood pneumonia deaths. Thank you very much. We hope you can take this data and share it. It's designed to be shared widely. to facilitate a deeper understanding of the cost benefit of PCV, the relatively low costs to countries, but the massive benefit in terms of child lives saved from a single intervention. Thank you very much.